In hospital, we aim to provide safe healthcare. Become an active member of your healthcare team. And you and your family can play a vital role in making your care, safety, and hospital stay a more positive experience. Patients enjoy better outcomes by participating in decisions about their condition and treatment. Tips on how to be involved more in your care. Ensure you are involved in your handover at least once a day. Speak up if you have any questions or concerns, or if something doesn't seem right. Tell staff if you think you're about to be given the wrong medication, have the wrong test, or if you think you've been mixed up with another patient. Let a staff member know if you are in pain. Ask about your options for pain relief. Ask someone you trust to be with you when having important discussions with staff about your care and treatment, to advocate for your interests and to be a part of your healthcare team. If during the course of your or your loved one's stay you become concerned with their medical condition, please let us know. You can speak with the nurse or doctor looking after you, or ask to speak with the nurse manager. If you are still concerned, dial 9 from the bedside phone and report your concerns. As a patient, you can expect these procedures to be followed. Each staff member should introduce themselves to you and discuss with you what they are going to do before they begin. You should be able to easily see their identification badge. Each staff member should check with you before they give you medications or any treatment. They will check your identification band and ask you your name. This is to make sure we give the right care to the right patient. Remind staff to clean their hands before they deliver care if you've not seen them do so. Falls are the most common cause of injury in hospital and can delay your recovery. Falling over in hospital is more likely because you are in an unfamiliar environment, affected by medication, and may be physically weaker than usual. It is important that you, your family, and staff all work together to reduce the risk of falls by making sure you can reach the call bell beside your bed, using the call bell to ask for help whenever you need it, calling for help as soon as you can. We try to answer immediately, but if the ward is busy, it may take a few minutes before a nurse can get to you. Wearing supportive, flat, non-slip shoes or slippers. Bringing in your walking frame or stick, glasses or hearing aids to hospital, and keeping them close to you. Turning the light on so you can see before getting out of bed. Walking and staying active when family, friends and staff are there to help you. Listening to advice and recommendations of staff. Recovering from illness or surgery takes time, and you might need more help with walking and getting to the bathroom than you realise. If a patient is confused, family members and visitors can help by staying with them as much as possible and letting staff know how to reduce their confusion if possible. It is also a good idea to let a staff member know when the family member is leaving. Hand hygiene is the single most important factor in reducing hospital-acquired infections. Our hands may look clean, but many germs are invisible to the eyes. We can unknowingly transmit germs on our hands to others and our environment. Hand hygiene is a term used to describe the use of soap and water or a waterless hand rub to cleanse your hands. The best way to prevent infection during your stay is to wash your hands often and well. This includes anyone who comes to visit you, including family and friends, nurses and doctors. It is okay to ask healthcare workers to wash their hands before providing your care. Hand rub is available at the entrance to every room. Mistakes can happen with your medicines when you go into and come out of hospital or change wards. Having the right information about your medicines at all times will prevent mistakes. Health professionals need to know about all the medicines you use so they can make the right decisions about your health. Medicines include prescription, over-the-counter, herbal and natural medicines, and come in different forms such as tablets, lotions, patches, puffers and drops. When coming into hospital, take your medicines list and medicine containers with you and show them to the doctor, nurse or pharmacist. You can help prevent medicine mistakes with an up-to-date medicines list. Order, print or download an NPS, National Prescribing Service Medicine List from www.nps.org.au/medicines list or ask your pharmacist. It is available in any other languages and as an iPhone app. As a safety precaution, Dorset or Webster packs cannot be used in hospital, so please arrange for your original medicine containers from your pharmacist to be brought into hospital with you. Always speak up if you are unsure about your medicines and let staff know if you have any allergies or have had bad reactions to medication in the past. When being discharged from hospital, ask what medicines you should continue using at home and for all changes to be explained. Leave hospital with an up-to-date medicines list to share with your local doctor and pharmacist. Staying in hospital may increase your risk of forming blood clots in your legs or lungs. We will assess your risk of developing a blood clot, but please feel free to ask your nurse or doctor about your level of risk. To reduce the risk of developing a blood clot, take any tablets or medication your doctor prescribes. Keep your compression stockings on. Avoid sitting or lying for long periods if possible. Walk as often as the staff looking after you recommend. Ask what to do to avoid the risk of a blood clot when you go home. Call your nurse immediately if you experience the following symptoms: pain or swelling in your legs, pain in your lungs or chest, or difficulty breathing. A pressure injury, also known as a bed sore or ulcer, can form when you sit or lie in the same position for a long time. The risk of pressure injury increases if you stay in bed, have poor circulation, or you are not eating well. A pressure injury can look like a reddened or blistered area on the skin. Bony parts of the body like the heels, tailbone, toes, and the back of your head are the most at risk of a pressure injury. To help prevent a pressure injury, you can keep moving as much as it is safe to do so. Change your sitting or lying position as often as you can. Look after your skin and tell a staff member if you think it looks or feels different. Eat a balanced, healthy diet. We prepare a pressure injury management plan for every patient who is staying overnight in hospital. Ask your nurse to explain the plan to you. Your care is important to us. Thank you for taking the time to listen.
It's good to know what you want to achieve with your healthcare plan. That's why setting goals with your healthcare provider is a great idea. Your healthcare goal could be symptom relief, getting back to your usual activities, or something else. Here are some tips for setting and achieving your healthcare goals. Think about what's important to you. You can have several goals if you want to. To get the most out of your healthcare, your goals shouldn't be too easy. Share your thoughts, decisions and treatment goals with your healthcare team and anyone else you choose. Keep a record of your healthcare goals so you can share it with whoever you want or need to. Know who will be caring for you and how they will help you. Work with your healthcare team to track your progress. Remember, your goals can change along the way, and that's okay. Your healthcare team will be there to support you, so take the time you need to identify and achieve your goals. Be open, ask questions, and stay involved. For more information, ask your healthcare provider or visit our website.